Hi, this is Dr. Casey Boggs. I'm a chiropractor with Boggs Chiropractic. I wanted to take a moment to share some information with you today about sinuses. This is the time of year where a lot of people start having some issues with their sinuses, but a lot of people really don't understand what the sinuses are, what they do, what's affecting them. So there are four main types of sinuses, or four locations where you have sinuses. So first is the frontal bone, which is this bone sits right up here on your forehead. Then you have the maxillary bone, which is basically the upper jaw. You have the ethmoid bone, which is right behind the nose, and then the sphenoid bone, which basically goes from temple to temple. So the sinuses themselves are really just air pockets within those bones. And the sinuses have a lot of different functions to them. So just read off a few of them for you. So they humidify the air. They help with your vocal resonance, how we can talk so well. They protect against infections. So basically the fluid buildup we get a lot of times is really just our body's protective mechanism to make sure no infections are getting on up into the brain, because that would be a bad thing. They also are going to provide some structural integrity. They provide shock absorption. So when you have any kind of head impact, it's not going to do as much damage to the brain because those air pockets absorb some of the impact. They will help regulate air pressure and also temperature regulation. So there are a lot of different purposes. Those aren't all of them, but certainly some important ones. There are some things that can affect the sinuses. If you have any kind of structural problem, like a deviated septum, certainly will affect how the sinuses perform their functions. Infections will certainly affect that. Allergies, environmental issues like just cold air in general, or dry air is certainly going to affect your sinuses. The one thing I wanted to spend some time talking about that we see in our practice, and this isn't for everybody, but we get a lot of patients that come in with chronic sinus issues where even if they're not sick, they're still having some sinus issues. So what we find a lot of times is a misalignment of a cranial bone or a facial bone can impact the drainage of the sinuses. So the sinuses drain through ducts and they go into the back of the throat. A lot of the interstitial tissue will kind of drain into those ducts. But sometimes you have inflammation, which might be a result of a misalignment, irritating some of the tissues. Or it could be that a misalignment is just closing down one of those ducts and that you just don't drain properly. So misalignments of the cranial bones usually happen either from a trauma to the head, but most of the time it's actually just from repetitive postures. So specifically, if somebody's always sleeping on one side, maybe the pillow's always pushing against this bone, the sphenoid bone can slightly shift just a little bit, and that can create some stress to joints where that connects to other bones. Frontal bone, kind of same thing. If you ever see somebody where the forehead looks almost a little sloped on one side, that could be a misalignment of the cranial bone. So what we do for those patients, there's some tests that we can do to figure out if they have a misalignment. But this is an adjusting tool that I would use. So just for an example, if somebody had a misalignment of this bone right here, the zygomatic bone, sometimes we'll get out of position. So we'll do some tests, figure out which direction that needs to go, and then we'll usually find out. We put this against our finger or thumb, and we just do an impulse into that just to shift the bone slightly, loosen up the joint tissue, and a lot of times that will help drainage with the sinuses. It doesn't work for everybody, but for a lot of patients with chronic sinus issues, it can make a big difference for. Now again, getting some that stuffed up feeling, sometimes that's just part of having an infection where your brain is trying to protect itself against that. But for a lot of people where that lingers on longer than it should, or it just keeps happening over and over again, that's somebody we might be able to help. So I'd appreciate it if you share that with somebody that's having some sinus issues. If you have any questions, we'd love to help you out. Thanks.